Good afternoon, everyone. And the first item of business this afternoon is portfolio questions. And in order to get as many people in as possible, I'd be grateful if we could have short and succinct questions and indeed answers. Question 1, Adam Ingram.
Thank you, Presiding Officer. To ask the Scottish Government what information it has on how the performance of NHS Scotland compares with the NHS in other parts of the UK.
Thank you. Minister Michael Matheson.
Over recent years, various organisations have published analysis of how the NHS performs across the 4 countries of the UK. This includes the recent work undertaken by the Nuffield Trust and work in 2012 by the National Audit Office. Both reports highlighted Scotland's strong performance when compared with the rest of the UK on waiting times and how Scotland benefits from higher staffing levels. For example, the Office of National Statistics has previously compared hospital waiting times for specific procedures, an analysis which we have had updated and which is included in the Nuffield Trust report. This demonstrates that for many procedures, such as hip and knee replacement and cataract surgery, average waiting times are lower in Scotland than both England and Wales.
Thank you. Adam Ingram.
I thank the Minister for his response. And given this superior performance of NHS Scotland, could the Minister outline the implications for future performance with a no vote in the referendum in September?
Well, the NHS in Scotland is already operating independently, and we can also point to many successes under devolution within NHS Scotland. Devolution has provided us with the opportunity to take forward policies which benefit the people of Scotland. For example, we've been able to take forward free personal care for the elderly, free eye and dental health checks, free prescriptions are all major achievements under devolution. Scotland has also taken a very different path from the NHS that's been taken by the UK Government. We've defended the NHS against the privatisation which is happening south of the border. We've avoided multiple reorganisations and the privatisation south of the border, which has allowed us to focus on issues around patient safety and quality of care. The current Scottish Government's vision for the NHS in Scotland is to maintain our publicly owned, publicly funded health service provided free at the point of delivery. A no vote would put at risk the ability to protect Scotland's NHS budget from cuts as a result of the privatisation agenda in NHS England, and would reduce our ability to use the full range of levers to promote good health here in Scotland.
Thank you. Neil Findlay.
Meanwhile, back in the real world, Presiding Officer, the Nuffield Foundation report highlights how Scotland is falling behind other nations of the UK in a number of fronts, but also making very welcome progress in others. One of the areas of real concern is the fact that we're falling behind comparator regions of the UK like the North East of England in life expectancy and mortality. What action is the Government taking to improve life expectancy of all Scots, but especially those who are dying far too young?
Minister.
Well, the member will be aware that life expectancy in Scotland is increasing, but it's not increasing at as fast a rate as we would wish to see. But you also understand that the whole issue around life expectancy is a complex one related to health inequalities. And in order to tackle these effectively, we need to make sure that we tackle the social inequality that causes the shortening of life expectancy in so many deprived parts of Scotland. And a key part of that is not only looking to the health service to try and deliver some of the answers to this, but it's also about making sure we tackle these social inequalities. And in order to do that, we need to make sure that we've got the full range of powers that allow us to do that effectively in order to undermine and to address effectively the inequalities that have blighted Scottish society for far, far too long.
Thank you very much. Jackson Carlaw.
Will the Minister confirm the response the Cabinet Secretary gave me, confirming that the Scottish Government expects to receive £1.3 billion in consequential spending for the health service as a result not of cuts, but of ring-fencing and increased spending in the health service in England? And does he not think that that additional money has contributed towards the very considerable efforts the Scottish Government have been able to make in the improvement in Scotland's health service?
Minister.
Of course, the member will recognise that if there is a reduction in the health service budget in England as a result of privatisation of its agenda, it will have a direct consequence on our Barnett consequentials from the health service in England. And equally, it's also interesting to take note that neither the Labour Party in London or the Tory Party in London are committed to maintaining the Barnett formula, the consequences of which could be actually very significant on the health service in Scotland, which is why exactly we need to make sure, that we protect the Barnett formula until Scotland becomes an independent country to manage its own health budget in a way that best suits our needs.
Thank you. Question 2. George Adam.
Thank you, Presiding Officer. To ask the Scottish Government how it is raising awareness of multiple sclerosis.
Mr Michael Matheson.
Through the Neurological National Advisory Group, we are working closely with our stakeholders to ensure that people in Scotland living with all neurological conditions, including MS, have access to high-quality, person-centred, safe and effective healthcare services. I am pleased to advise that our third sector partners, including the MS Society, are an integral part of this group and will help to shape the priorities of the group's working plan for the coming year.
Thank the Minister for his answer. As the Minister will be aware, it is currently MS Awareness Week, and this year's focus is on the right treatment at the right time, and how we can make Scotland a leader in ensuring that everyone with MS can access information, support and treatment they need. Can the Minister assure me that the Scottish Government will work with the MS Society and other partners to ensure people with this condition do get the right treatment at the right time?
Well, Ministers do expect NHS boards to have robust processes in place to ensure the provision of safe, effective and person-centred, high-quality patient care, which should be delivered by the right professional at the right time for patients when they require it. The Scottish Government is fully committed to working with our stakeholders, and we know that people who do have conditions such as MS value the support provided by the MS Society. As I mentioned, they are an integral part of our National Neurological Advisory Group, which oversees the work nationally to progress neurological services. I can also advise the member that officials recently met with the MS Society to discuss the key themes of the Treat Me Right campaign, and along with the National Advisory Group will explore ways in which we can support the needs of people with MS in accessing information, support and treatment. We recognise the lessons we can apply in supporting people with MS, alongside that of making sure that they get the right type of treatment and support at the right time.
Thank you. Question 3, Liz Smith.
To ask the Scottish Government what progress it has made in reducing the time it takes for people to see a hearing specialist.
Minister.
The way audiology services are provided has continued to evolve in recent years, with many boards, for example, now offering a one-stop clinic service. This means that some patients receive their consultation and, where appropriate, are fitted with a hearing aid or start treatment in one visit. Progress is monitored on a regular basis of the treatment time standard set as part of the delivery of the 18-week referral to treatment target. The latest figures published for all specialities in February for the month ended December 2013 show that throughout NHS Scotland, 90.8% of patients received their treatment within the current national standard of 18 weeks. The compliance rate is 90%.
Thank you very much. Liz Smith.
Thank you, Minister, for that. The statistics that you've just mentioned that did appear in February do, however, point to the fact that there is very considerable inconsistency about the way in which the statistics per region are calculated. Could I ask the Minister if he's got plans to address this, and also to ensure that there are audiology departments in every health board which are looking to address the issue of how quickly we can get the basic equipment to people with hearing difficulties, and that includes training some people in the third sector to help with that?
Minister.
Well, if the member has got some specific examples of where she feels there is an inconsistency in the way in which the data is being collected, I'd be more than happy to look at those specific points if the member wants to pass that information to me, because we would expect a consistency of approach across all of our boards in Scotland, of course, in order to measure their performance against the RTT. There has been a significant improvement, though, it must be said, in the way in which audiology services have been delivered over the last 4 to 5 years because of the national strategy which we've taken forward, which has resulted in the redesign of services. And the member, I'm not sure whether she participated in the debate yesterday evening here in the Chamber, where there were examples given of the way in which there's been partnerships forged between our NHS boards, our local authorities and the third sector in delivering audiology services, for example, the small bits of equipment, replacing tubes, etc., that can be done by third sector organisations. And only last week I launched our new sensory impairment strategy, See Here, which is the first sensory impairment strategy of its type in the UK to bring together both visual impairment and hearing impairment services to make sure that they are much more effectively aligned and that they are actually much more patient-focused. And a key part of the work we expect to take forward as part of this strategy will be to make sure that we have good coordination taking place between the statutory sector and the third sector and how these services are delivered going forward.
Many thanks. Question 4, Murdo Fraser.
Thank you. To ask the Scottish Government what its response is to new research that shows there to be no good evidence that the Tamiflu vaccine reduces flu-related hospital admissions or the complications of influenza.
Minister.
Tamiflu is not a vaccine, it is an antiviral medicine for the treatment and post-exposure prevention of influenza. We will consider all new relevant scientific evidence. This will include the Cochrane collaboration reviews published on the 9th of April, which considered data from the initial trial of Tamiflu and another antiviral medicine, Relazine, dating back to the late 1990s. It will also include evidence from other studies carried out since the medicines were licensed, which will support the view that we can help to make sure that we are providing the right type of approach in this area of policy, and also making sure we're using antiviral medication that can help to reduce the risks to individuals.
Can I thank the Minister for his response? Can he tell us how much money was spent by the Scottish Government on stockpiling Tamiflu? And can he also tell us if there is, as he seems to be indicating, to be a review into the future use of this drug? Can he tell us when details of that review will be made available to the public?
Well, I can inform the member that we do intend to work with the other nations within the UK to review the stockpiling of the antiviral medication Tamiflu and the Relazine as well, to evaluate whether that's the most appropriate approach that we should take forward in the future. It is worth keeping in mind that the approach which we have taken in Scotland is consistent with the guidance which was issued by the World Health Organization and the approach that has been taken by other European and North American countries around stockpiling for pandemic flu. And it dates back to the approach that was set out in 2005 in terms of the state of preparedness that the country should take for the potential for a pandemic flu. At that time, it was bird flu. The review will be carried out over the coming months, and we expect it to report by the end of this year. We wish it to report by the end of this year because there are some elements of the antiviral stockpile which are due for replacement next year, and it would be helpful from our perspective to have the review completed by that point in order to inform that particular process. In relation to the second point that the member made, we stockpile antiviral medicines which is sufficient to cover 50% of the population. 35% of that is Tamiflu and 15% is Relazine. Of that, the total market cost of stockpiling Tamiflu is £21.1 million and £12.9 million for Relazine.
Many thanks. Richard Simpson.
Thank you. Can I welcome the Minister's very considered reply in view of the fact that I recommended to the Health and Sport Committee that they should recommend to the Government the stockpiling of Tamiflu, and at the time the evidence was strong. But the point I want to ask the Minister about particularly is, will he now get his Government to throw its weight behind the campaign to require the pharmaceutical industry to publish all its research prior to licensing, rather than the hitherto partial research which was published in this case and led to Tamiflu being thought to be of huge value?
Minister.
Well, I fully agree with the member that it's in the interests of the pharmaceutical industry, I think, to be very open and transparent about the evidence they have at the time of seeking a licence for any type of vaccination or medication. And I would be more than happy to offer my support to the member's call for the pharmaceutical industry to be as transparent as possible. It is worth keeping in mind that since the Cochrane collaboration review took place, there are some elements of research which have not been included in that particular element of review work, particularly observational studies which were undertaken that also have to form part of the review which will take place this year. So I think it's an opportunity to take time out, if you like, to evaluate the types of medication which we are stockpiling to assess whether it is the most effective. If it's not the most effective, what are the other options that may be available to us, and to look at how we can take that forward in the years to come.
Many thanks. Question 5, Angus MacDonald.
To ask the Scottish Government what action it is taking to increase the number of automated external defibrillators in public places.
Minister.
Substantial investment in heart disease services has reduced Scotland's premature death rate from coronary heart disease by over 40% in the past 10 years. In February 2014, the Cabinet Secretary for Health and Wellbeing announced £100,000 for public access defibrillators across Scotland to support the Scottish Ambulance Service's Community Resilience Strategy. And in March, I announced a further £1 million for the installation of defibrillators in NHS dental practices. Together, these represent an important contribution to our goal of reducing the number of out-of-hospital cardiac deaths.
Thank you. Angus MacDonald.
Thank you. I clearly welcome the progress the Minister has outlined. Public access defibrillators make a positive contribution to safer and sustainable communities around the country. I've also been made aware of a community initiative in a neighbouring constituency, in fact my colleague Bruce Crawford's constituency.
Could you come to the question, please?
Where telephone kiosks have been used to host AEDs. Will the Scottish Government continue to work with third sector, private partners and community groups to ensure AEDs are ultimately available in every public place where people gather?
Thanks. Minister.
I've no doubt the members across the chamber have come across AEDs in a variety of locations across the country. I was surprised to come across one recently at the Cashline machine in Portree in Skye, which again is part of the national network which has been rolled out across the country. Of course, as a government, we recognise the value of these. That's why we've made the recent funding announcements to support the rollout across the country. And of course, we will work with third sector organisations who I know have been very active in this particular field to make sure that we have a coordinated approach in this whole policy, because it's important that once an AED has been installed within a particular location, that the Scottish Ambulance Service are always also aware of its particular location so that they can direct patients or individuals to a particular unit at a given time. So I'm more than happy to give an assurance to the member that we will continue to work with the Scottish Ambulance Service and both the third and private sector in making sure that we get a proper network of AEDs across our communities in Scotland.
Thank you. Question 6, Jamie McGregor.
To ask the Scottish Government how it ensures that dialysis services are accessible.
Minister.
The Scottish Government is committed to ensuring that all people in Scotland living with long-term conditions are able to access the best possible care and support. Our quality strategy sets out our vision for healthcare services that are safe, effective and person-centred. We provide policies, frameworks and resources to NHS boards so that they can deliver services that meet the needs of their local population. Within this context, the delivery of local services, including the provision of dialysis treatment, is the responsibility of individual NHS boards who take decisions based on local priorities as well as evidence-based national clinical guidelines.
Thank you.
I thank for that answer. There has been a national target for many years now that NHS boards should provide hospital dialysis within 30 minutes travelling time of all patients' homes where possible. However, currently a number of kidney dialysis patients in the Campbelltown area have to travel 3 times a week to the Vale of Leven Hospital for treatment, a round trip each time of over 230 miles and taking 2 hours 40 minutes each way. What can the Minister do to help reduce these lengthy travelling times, and does he agree with my constituents that a satellite dialysis unit within Argyll and Bute would be a significant improvement either in Campbelltown Hospital itself or at the Loch-Gilphead Hospital in Mid-Argyll?
Minister.
I do appreciate the concern that Jim McGregor's raised on behalf of his constituents and the length of time and the energy that's involved in travelling to get access to dialysis, particularly for those who do stay in our remote and rural areas. Although the target is a national one, there are specific difficulties in being able to achieve that particular target in rural areas, and to also make sure that services can be delivered in a safe and effective way for the patients who require access to them. I do understand that NHS Highland recognise the particular problems that some of these individual patients are experiencing, and I've been in dialogue with them directly to look at whether there are any measures that they can take in order to address some of the very disproportionate travel times and costs that are involved with their travelling. I also understand that NHS Highland have also undertaken to consider again the case for a low-maintenance dialysis unit in Argyll and Bute in 2015-16, and I'd be keen to see that process taken forward as quickly as possible. And clearly, if there is the opportunity for a satellite dialysis unit to be provided, and it can be done in a safe and effective way that would be appropriate to the patients of that particular area, then I would expect the NHS Board to look at pursuing that once they've undertaken the review work in this area.
Thanks very much. Question 7, Hans-Ala Malik.
Thank you and good afternoon, Presiding Officer. To ask the Scottish Government when the Cabinet Secretary for Health and Wellbeing last met representatives of Greater Glasgow Health and Clyde to discuss dentistry.
Minister.
Ministers and government officials regularly meet NHS boards, including NHS Greater Glasgow and Clyde, to discuss health matters, including dentistry.
Hans-Ala Malik.
Thank you for that response. I am concerned about a number of gravely ill and vulnerable people forced to wait months for prior permission approval for their dental treatment. A seriously concerned constituent informed me of an elderly lady with dementia who required a home visit to get new dentures, waited nearly 2 months for approval, during which time she was unable to eat. In another case, a cancer patient who had lost 5 stone and has dentures no longer fitted him, his dentist took the decision to cover the costs of the dentures himself rather than wait for permission, patients waiting. I would like to know what the Minister is doing to ensure that people who are seriously unwell or vulnerable and require home dental visits are doing, and not additionally tormenting the patients unnecessarily. And may I also suggest that perhaps the Minister would consider fast-tracking patients of this calibre who are either very seriously ill or, in fact... I
think we've got the point. Minister?
Can I say I recognise the concern that the member has raised, and I would be concerned if there were individuals waiting unacceptably long periods of time for Practitioner Services Division to approve particular forms of treatment. There can, of course, be a number of reasons as to why there can be a delay in approval in terms of the insufficient information being submitted, etc. But where that is not the case, I would expect Practitioner Services Division to be able to respond to those requests in a timely way. And I would also expect priority to be given to those individuals where there's an urgent need for treatment to be agreed as well. If the member has some specific examples he wishes to furnish me with, I'd be more than happy to make sure that Practitioner Services Division look into that matter and provide an explanation as to why there was any delay around that issue. And I'm more than happy to give him an assurance that I will ask my officials to make sure that Practitioner Services Division are prioritising high-priority cases and that they have a robust mechanism in place that allows that to happen. But if he gives me some of those particular examples, I'm more than happy to make sure that they are thoroughly investigated and that he gets a response to them.
Excellent. Many thanks. Question 8, Patricia Ferguson.
To ask the Scottish Government what action it is taking to address low life expectancy rates in Glasgow.
This Government is pursuing evidence-based health improvement measures on the ground. Last year, Glasgow Health Board received £30 million of prevention funding to tackle areas such as problems as alcohol diet, tobacco and drugs. And through our commitment to legislate on plain packaging, minimum pricing and our ambitious physical activity programme to create a lasting legacy from the Commonwealth Games. However, as stated in the recent report of the Ministerial Task Force on Health Inequalities, the problems cannot be solved with health solutions alone, as other factors such as entrenched problems of social inequality, such as poverty, also play a significant role, particularly in health inequalities. We are therefore taking the fight beyond the NHS with our Early Years Collaborative, the launching of a child poverty strategy to tackle the root causes of poverty, and working closely to drive forward improvements in 8 transformational regeneration areas in Glasgow.
Thank you. Patricia Ferguson.
I thank the Minister for that answer. As the Minister is aware, life expectancy for men in Glasgow is at the moment about 7.5 years less than for those in East and Bartonshire, while for women there is a difference of some 4.9 years. Clearly, this is an average figure, and for some areas of Glasgow, the gap will be even greater. So can the Minister advise what additional help is going to be given to those GPs working in the so-called deep end practices to ensure that they have the resources to allow them to tackle the elements of this complex issue that are within their remit?
Thank you. Minister.
I think the member raised what is a very good initiative, the deep end practices, and the way in which they are able to help to provide, they're helped with some support to assist their the type of demand which they are experiencing. Can I say that I've met with some of the deep end practice GPs who are extremely committed to this particular agenda in tackling inequality within their own communities and to use their own resources as an effective way of delivering that. We are presently considering how we can actually add to the particular role that they have and how we can augment the staffing levels that they have at the present time in order to support the work which they are undertaking within their more deprived communities. But it's a model which I think can lend itself to helping to undo what are very often intergenerational problems, and that additional resource needs to be able to make a real difference on the ground to how they can help to support individuals more effectively in order to break that link with what are very often ingrained health and social problems that very often blight individuals' lives and lead to a much shorter life expectancy. And it's unacceptable in a society that we should tolerate that, and we should use every possible lever we have in order to make sure that we break that link where we can.
Many thanks. Question 9, Sarah Byatt.
To ask the Scottish Government when it last met representatives of the NHS Lothian Board.
Minister.
Ministers and senior officials meet regularly with the boards of both members of NHS Lothian to discuss issues of interest to the people of Lothians.
Thank you. Sarah Byatt.
Minister, while I very much welcome the fact that reports are now being prepared in the light of shocking revelations about GP surgeries being open but full, with patients waiting weeks for an appointment, and given the importance of swift access to GPs for early diagnosis, crucial for so many conditions, and given the huge pressure we now have on GP services, will there be urgent financial support available to increase the supply of GP services, given the time lag for training new GPs and investment in premises that NHS Lothian, doctors and patients groups believe we urgently need?
Minister.
Well, as the member will be aware, we've been taking forward a range of measures at a national level through national policy in order to model our services in a way which allow us to shift the balance from the acute sector more effectively into the primary care sector to help to support individuals more effectively within their own community and within their own home. And an important part of that, of course, is our GP services. It's important that our health boards, including NHS Lothian, have the right type of provision in place in order to meet the needs of their local community. We have increased funding to NHS Lothian. They've also had an NRAC uplift as well in order to help to meet the demands which they are facing as well. And we would expect the board to make sure that it utilises its resources in a way that allows it to meet those growing demands. But alongside that, it's also extremely important that services are planned in such a way that it's not the health service operating on its own, but it's working in partnership with the local authority and how it delivers services. And I'm very much of the view that a key part to the way in which primary care services can be more effectively planned is through better joint planning between local authorities and our health services, and using their resources collectively in order to meet the needs of local communities. So I want to give the member an assurance that we recognise the importance of primary care, the resources which boards have been given are there in order to make sure that they are planning effectively to meet the needs of their local community. And it's important that we make sure that we have our local authorities and our health boards working together in order to maximise the resources they have within our local community in order to make sure that primary care can be delivered in the most effective way within the community.
Thank you. Malcolm Chisholm.
But is the Minister aware that the population of Lothian is expanding more quickly than any other part of Scotland, and that Lothian still has a long way to go before it receives the NRAC share to which it is entitled? So given the intense pressure on GP services, and certainly I'm contacted in my constituency about this on a regular basis, will he at least look at providing additional funding specifically for the funding of the primary care services, which I know he wishes in principle to expand?
Minister.
Well, it is important that NHS Lothian use the resources they have at the present time most effectively to meet the growing demand which they face. But with regards to the NRAC formula issue that he said that we are still some way away from achieving, by 2016-17 we expect all of our boards, or none of our boards, to be below 1% of funding parity, because we've been accelerating that process, which has resulted in some additional funding for NHS Lothian. So, for example, NHS Lothian received an NRAC parity adjustment of some £12.275 million in 2012-13 and a further NRAC parity adjustment of £17.521 million in 13-14. So we have been accelerating that process to make sure that those boards are looking for parity receive so as quickly as possible, and by 2016-17 it should be below the 1% figure that I mentioned to the member.
Thank you. Question 10 in the name of Ken McIntosh has not been lodged. A less than satisfactory explanation has been provided. Now call question 11, Roderick Campbell.
To ask the Scottish Government what its position is on the full report on the future of residential care for older people in Scotland.
Minister.
The Scottish Government welcomes the constructive joint working between the Scottish Government and COSLA through the high-level task force on residential care for older people. The recommendations in the report will play a vital role in how we work with our partners to develop the Scottish residential care sector in the future.
I thank the Minister for his answer. The report calls for further work to be undertaken to examine how much additional funding would be required to bring care workers' pay up to the living wage standard. Can the Minister advise whether the Scottish Government will commit to investigating this, given the absolute importance of carers, the need to reduce staff turnover and the benefits of a career structure for carers?
Minister.
Well, Presiding Officer, the Scottish Government has led the way in implementing the living wage for all staff covered by its pay policy and for all staff in NHS Scotland, and is working to encourage all other employers to pay the living wage. The Scottish Government has also introduced the Procurement Reform Bill, which includes provision for statutory guidance to ensure that wherever relevant workforce matters, including pay and benefits, are fully evaluated as part of the public procurement process. It's extremely important we make sure that our staff who work within the care sector are provided with the right value for the important work that they undertake, and we absolutely recognise the importance of carers, and we are already working with partners to address some of the issues which have been highlighted in this particular report, including the issue around the living wage being made available to those within the social care sector.
Thank you. Mary Scanlon.
Thank you. The report also states that there is currently insufficient funding for investment in the care home sector, with publicly funded residents generally being cross-subsidised by self-funding residents and many providers relying on expensive, complex debt packages to stay viable. What is the Government doing on these two issues?
Minister.
Well, the member may be aware that for many years there has been a marked difference between what a self-funder pays and also someone who is paid for by the local authority. That's a long historical anomaly that has been in the system, which was highlighted by this particular report. And in relation to the particular points that the member raised, she'll be aware that one of the things that the report has highlighted is the need for greater transparency around how care costs are actually calculated, so that individuals and others can see very clearly how the care costs have actually been calculated, and how we can also achieve greater consistency around them. And that's why, given the amount of detail that's in this particular report, we're going to work with COSLA and other partners, such as the care sector in Scotland, and looking at how we can take forward the recommendations within this report to get greater transparency around the very issues that the member has highlighted, to make sure that there are no hidden costs and that we don't get into a situation where there's a perception of cross-subsidy taking place between one resident and another.
Thank you. Rhoda Grant, briefly, please.
Thank you, Presiding Officer. Given that the report calls for the living wage for all those employed throughout the care service, and the EU has confirmed that there is no barrier in European law to stop the Scottish Government implementing a living wage, will they now back Labour's proposals in the procurement bill and ensure that a living wage is paid to all public service contracts?
Thank you. Minister.
Well, the member should be no doubt about this government's commitment to the living wage, and we have proven that by the measures that we have taken forward, unlike the previous Labour government at Westminster. But what I can assure the member is that the details that have been set out in this particular report are ones that are not about just taking a quick reaction to or responding to briefly and in a short period of time. There are some very complex issues that have to be worked through in order to make sure that our care sector, in particular our care home sector, is fit for purpose and that we have the right level of support in place for future years. And that's why we're going to work with our colleagues in local government and also within the independent and the third sector to make sure that we look at taking forward these recommendations in a measured way in order to make sure that we have a sustainable social care service and social care sector in the future.
Thank you. Question 12, Rob Gibson.
Thank you, Presiding Officer. To ask the Scottish Government when it last met the Scottish Ambulance Service to discuss crewing in remote communities.
Minister.
The Scottish Government is in regular contact with the Scottish Ambulance Service on a range of issues, including the mix of skills required by ambulance crews to support the delivery of high-quality patient care across Scotland, both now and as we strive to deliver the 2020 vision for healthcare.
Thank you. Rob Gibson.
I thank the Minister for his answer. The Minister will be aware of the positive contribution that ambulance service personnel can make when recruited and living in small communities, where a full roster can avoid single crewing and the consequent delays for patients. Will he ensure that Kinlochbervie gets a full-time ambulance team, which the nearest neighbouring community, Lochinver, already has, with a similar geography and population?
Minister.
Well, the member will be aware that there are at times challenges in being able to make sure that we have the right ambulance service cover in all parts of a rural area, and the members highlighted the particular issue that Kinlochbervie are presently experiencing. I would expect the Scottish Ambulance Service to look at trying to make sure that they have the right crewing levels within the local area in order to meet local need. It is extremely important to make sure that we have the right training of the staff who are also crewing these particular ambulances, because they will very often have to travel considerable distances with individuals before being able to get medical cover. But I'm more than happy to give an assurance to the member that I'll ask the Chief Executive of the Scottish Ambulance Service to look into the particular concerns that the member has raised in order to look at what can be done to address the concerns that the residents and his constituents in Kinlochbervie have around the way in which the ambulance service is operating within their community.
Thank you. Question 13, Bruce Crawford.
Thank you, Presiding Officer. To ask the Scottish Government when it will publish the finding of its consultation on the control of entry arrangements and dispensing GP practices.
Minister.
The independent analysis of the consultation response is now complete, and a report has been submitted to the Scottish Government. This has highlighted complex and competing views and issues expressed across the range of respondents, which are extremely helpful in informing how we go forward. We will announce very shortly on how we intend to take forward an amended framework of control of entry, which we believe will best meet the service needs of communities across Scotland. This will build on the themes and the responses to those themes tested in the consultation exercise.
Thank you. Bruce Crawford.
I thank the Minister for his reply. Is he aware that recently in my constituency of Stirling, applications to open new pharmacies were approved by the Pharmacy Practices Committee for Forth Valley in Drim and Aberfoyle? No doubt that in both these areas that services provided to local GP practices will suffer. The approval given the 20th of March for a pharmacy in Aberfoyle was greeted by shock and anger by myself and my constituents, given the significant weakness of the application. It is now potentially the subject of an appeal. Given this, can the Minister please be much more precise on exactly when the Scottish Government will bring forward the necessary changes to the regulations and how long it estimates before such amended regulations will become enacted?
Thank you. Minister.
Well, I'm sure the member would recognise that it wouldn't be appropriate for me to comment on individual cases, given that they are going to appeal. But I do recognise the concerns which have been expressed by the member, and I'm very aware of the similar concerns which have been raised by his constituents in their correspondence directly with the Scottish Government. What I can give the member an assurance of is that GP practices affected by the opening of a community pharmacy within their area remain eligible for funding for primary medical services which they are contracted to provide. And I would expect NHS Board, and in this instance NHS Forth Valley, to work constructively with those GP practices and their patients to continue to meet their reasonable needs. I can also let the member know that key aspects of the control of entry framework going forward will be underpinned with amended regulations which we aim to lay before Parliament and to come into force by the summer recess this year.
Many thanks. And that concludes portfolio questions. And we now move to the next item of business, which is a debate on motion number 9844 in the name of Annabel Goldie on Scotland's future. I'd invite members who wish to speak in the debate to press